Yes, certainly as a student counsellor, that's something we see all the time. In fact, it's one of our the most common presenting problems for the last, I'd say, 2 to 3 years here and nationally in student counselling service. So anxiety is a huge issue at the moment. Absolutely, absolutely. As I say, it's one of the most common presenting problems. And if you say that last year we had 300 clients, this year it's going to be up another 15-20% on that. And you're talking about, I don't know the exact percentage of anxiety, but it will be significant. Between, I'd say, 15 and 20% will present with anxiety of those. There must be a reason, because it's something that has spiked over the last number of years. I think in general, the whole financial meltdown has made people in general anxious about things. People are anxious about money. They're anxious about their career. A few years ago, students didn't have to worry about finances so much. There was so much work around. Now there isn't. So it all increases the general anxiety level in society, and students are victims to that too. It passes on to them too. In Dundalk for the last couple of years, the first, I suppose, most presenting issue is loss. So it would be either bereavement or the breakup of the parents' marriage. So that's a very common one. And then pretty close on that would be anxiety, would be our next one. Depression, the usual ones after that. Academic actually wouldn't be. People always think, oh, there'll be a load of academic issues. Not so much here. You would always get the more personal kind of issues more than that. I haven't looked specifically, but anecdotally, I probably would agree with you. Not a huge difference, but slightly more. Yeah. So if somebody's suffering from severe anxiety, one of the most important things to work with them is on their breath, on breathing. So on doing any relaxation that focuses on the breathing. And the number of students who look at you like, what? That's amazing. I've never thought of my breath before. I feel better already. So people don't think about that. But the breath is really important. So mindfulness, any kind of meditation. We use a meditation website that we would recommend very often. It has a huge impact. Doing something like yoga or whatever. Exercise. And then balance in their lives. Usually with anxious people, you'll find that their lives are very out of balance. So they're working crazy hours. They're studying crazy hours. There's no relaxation or time for self. And that causes the problem too. So it's a mixture of all those three things. So we wouldn't have just one way. We would use some bibliotherapy that's using books on anxiety. There's some very good ones. When panic attacks is one of the ones we would use most often with panic. We would also use some websites that we would recommend, cognitive behaviour therapy websites. So a number of different areas. Again, it's gone back to balance in their lives. Looking at their, is there balance? Is there time for fun? Is there time for relaxation? Is there time for friends? Is there time for exercise? And if you look usually with somebody who's very anxious, there will be a big spike in one area of their lives in terms of all their time is gone into that, and the rest will be ignored. So there's no interest, or if there are, they're not getting time. So that's a huge part of it. I don't really know, but I think there's just a generalised level, a raised level of anxiety. I do think that the whole financial collapse over the last number of years has caused that jobs are no longer certain. One of the things that has spiked among students over the last few years is whereas before they would think, well, if there's a problem, I can repeat. Now they're saying, I cannot repeat. There is no money. There's no financial backing from home. I can't get the work to finance myself. So that means I have to get these exams. So you can imagine that goes back into it, Plus, I think the general stress in society has put families under huge stress. And whereas when we were being asked 2 or 3 years ago, are you seeing the effects of the financial crisis in the counselling service, we would have said no. Now, the last 2 years, definitely we're seeing it where families, so we have a number of families say the father is working away. He's in America or he's in the UK, he's in Africa. So you can imagine what that does to a family. And then losing their home, the family home. So a number of people would have lost their family home. So all of these kind of things are seeping into the whole college environment. Plus, I think there's a general lack of a system to believe in. The church really has lost its way among people, and it hasn't been replaced with anything. There's no faith in politicians, naturally enough. Bankers, naturally enough. So who do you look to and who do you trust? So all of these kind of things, I think, hit this age group very much because you're looking for meaning, you're looking for something to look up to, you're looking for a way to live, especially at the ages between 18 and 25. And if there's nothing there, it can cause anxiety, I think, about where you're going and who you are. We would, last year, it wasn't GROW, it was one of the other mental health organisations ran a 6-week kind of group around depression. And we would have recommended that to a number of clients. There's a stress reduction one on at the moment. That's another one that we would recommend. In terms of organisations managing it, there aren't that many. So somebody with severe social anxiety, we would try to refer on to a social anxiety programme. There is one, or has been one locally, in the mental health services. That's a big one, actually, that we haven't really, I suppose social anxiety is big and on the increase. Just being able to deal with people and cutting yourself off. So I suppose, I hadn't actually mentioned that we've seen a good spike in that last year and this year. So there is a social anxiety group locally in the HSE that we would try to get people on. Again, hard to get them on it, but we would try. And if somebody comes to us in first year, you could be waiting up to 6 months to get on a programme like that, but we will support them in the meantime and then get them on it. And so we would use that as well, Well, mindfulness, there's so much on mindfulness at the moment. There are loads of them. But the main meditation website that we use is meditationoasis.com. It's a really good free website. There are about 30 or 40 meditations on it. You can download them. You can have them with you into the classroom, in the car, wherever. And that's what we find very, very good to use. But one of the things we're trying to do this summer, there are so many resources online now. We just trawl through them. We're also involved with Reach Out, and Reach Out have a range of resources on their website as well. And they now have a dedicated third level section, which we've been involved in with the My Mind Matters. My Mind Matters has moved into that. So there's a lot of stuff on that. There's a lot of relaxation and guided relaxation stuff on that, But I'd love to actually get into college classes and talk to them earlier on about a simple thing like breathing exercises. Because the ones we do take a few minutes, and yet somebody will feel immediately. You'll bring them from a state of panic to relatively calm within 5 minutes. So it's huge, What we have to remember here is that anxiety is a perfectly normal part of living. And that's the other thing that I'm wary of. I'm quite happy to say that somebody's feeling anxious, but I'm very wary of saying they suffer from anxiety, because it's making them a victim. They're not a victim. We're all anxious. The exams are on here at the moment. You try to find somebody who isn't anxious about their exams. There'd be something wrong with them if they weren't anxious and if there wasn't a general level of anxiety. So we need to just be very careful that we don't make it a disorder all the time. It's a normal part of living. You go to the dentist, you're anxious. You're meeting the mother-in-law for the first time, you're anxious. You're going out on a first date, you're anxious. All these things. It's when anxiety takes over it becomes a problem. But what I would like to get out to people is that it is very easy to deal with if you get the right help. And if you're prepared to get the right help, don't try and struggle with it on your own. And that's the big thing, that often when people come to us, I'm just thinking of somebody who came to me a few weeks ago, crippling anxiety. I did a couple of very simple exercises with him, and he came back to me 2 weeks later and he said, I'm fine. He said, that worked. And it was the breathing. And so what we're saying is, if you just try and deal with it on your own, it's difficult, but we can help. And that's what I would like to give out, is there's a lot of hope here. Very few people need medication. They manage it with, some guidance around exercises and stuff like that, and the willingness to look at where it's coming from. So hope, that's the big thing out of this.